everyone, this morning in Healthy Living, I'm joined by Dr. Glenn Gallaspy, and this morning we're actually talking about a subject that many women know about and that is common with women.
Correct. We're going to talk about pelvic organ prolapse. This is a problem that women have developed now that we're getting older. Women are living longer, developing these problems. They're very uncomfortable to the patient, and they would like correction. Now,
Dr. Gallaspy, talk to me, just so if women aren't familiar with it, what are some of the symptoms of this? Talk to me about what that is.
Okay. Well, you know, you've heard the term about your womb's dropped or your bladder's dropped. Those are layman's terms, but basically what's happened is the pelvic organs have moved from their normal position, have lost their structure, and have basically fallen.
Okay.
Some of the causes of this are certainly childbearing is number one. Also, women are living older now, so it gives us more of a chance for the tissues to lose their strength. And it's partly genetic. You do see it more in Caucasian than in Afro-American or Asian women, although they can see it in them too. And the connective tissues, which we call fascia, become broken over the years, like I said, with childbirth and things like that. And then you have the droppage, and it leads to a feeling of heaviness or discomfort in the vagina. Sometimes women will complain of some discomfort with intercourse. They'll complain of some involuntary loss of urine with any sort of exercise or laughing or coughing, and this is disconcerting. And sometimes they'll actually see a protrusion, and this it bothers them too.
Now, you've told me this can be very uncomfortable for those people who are experiencing this, and you guys have come up with some pretty good ways of helping these patients out.
That's correct. For years, we've been treating this for years, but mainly basically using the patient's own tissues and resuturing things, but it never worked very well, quite frankly, because the reason the problem exists because the tissues aren't that good, so trying to put them back together doesn't help. But now, through some medical technology, we've developed some ways to use some sometimes mesh maneuver, put some mesh into these areas, which if you could feel like, it sort of feels like the pantyhose type thing, but it's just a small bit of material, and we're able to attach that, and then we can move this tissues back into their normal place, and they hold. It doesn't break down again, and people get a great effect. You know, for instance, in an incontinence procedure, we now put a sling in. We don't tack your bladder up anymore. Right. And the beauty of it is now we can perform all these procedures vaginally, which is minimally invasive. It's much easier, much quicker recovery. You get a very good effect, and it's better than an open technique on an abdomen, or even a laparoscopic technique or a robotic technique where they're punching holes in the abdomen, and you can cause injury to structures and more excessive bleeding. So the vaginal approach is the ideal approach in these cases.
Okay, and Dr. Gallaspy, if someone's at home listening to this interview right now, they're questioning maybe they have this, or they could start to see some of these symptoms, what should they do?
Well, if you're noticing, you know, that you're having some involuntary loss of urine when you're exercising, or if you cough or sneeze, that's one of the symptoms. If you notice that you're having some discomfort with intercourse with your partner, as he's quote hitting something, or if you feel like a heaviness or a bulge from your vaginal area, then that would be cause to seek attention if this is discomforting to you.
Okay, well, thank you so much for joining us with this on this pelvic organ prolapse. Guys, we will put this up on our website, fox10tv.com, under the Studio 10 tab. So if you want to know more about this, we'll put this information up there. We'll also put some links and some phone numbers for you guys as well. So I appreciate you joining us this morning.
Enjoyed being with you.
Okay.